rock. All right. So like Peggy mentioned, we have worked on an internal process to address secondhand smoke complaints. And before I share kind of what we did, this initiative really kind of came up in conversations both with Peggy and then our housing stability coordinator here at the county, and just that the county doesn't support eviction. And so, we want to support the tenant or the person who's complaining about secondhand smoke, but we also don't think that evicting someone from their house is the way to go about doing that. So that kind of spurred lots of conversations with Peggy, with Raya, with a few other folks on this call about what we can actually do to like address these complaints in a way that doesn't displace people from their homes. So I will share my screen. So we came up with essentially a three-pronged approach to this. And so the first approach is a communications campaign. So kind of as part of our grant spend down in June, we worked closely with SE2 to run their ads for the quit line throughout Adams County. Originally, we wanted to just target the buildings where we had received secondhand smoke complaints for and just try to make it really targeted to those people. There's things you can do with cookies and all this crazy stuff where you can make these ads super, super targeted. However, since it was spend down, they said, well, we have enough money to do that for the whole county. So that's what we did. And I've linked the ads here and I'll share these slides with everyone at the end so you can access them too. But these are just kind of the I guess, standard quit line ads that SE2 prepared for all of STEP grantees. So we ran those. They're still running. I think they will stop running at the end of August, in which case, and then we'll be able to go back in and kind of see the results of those, see if we were able to get any engagement on those clicks, on those links to the quit line. So that's running throughout Adams County currently. The other thing we did is we worked with SE2 to design a flyer talking about the impacts of secondhand smoke on pets. And this came after meeting with a few property managers, one property manager specifically whose property was getting a lot of secondhand smoke complaints and who was willing to talk to us. I'm sure if you've answered complaints, a lot of times you reach out to a landlord or a property manager and they tell you to kick rocks or they don't respond. This one was actually really engaged. And so we had a meeting with her. And one of the things that she said, she's like, oh, it's just crazy. People care more about their pets than their neighbors. And I was like, you're so right. So we worked with SE2 to talk about the impacts of secondhand smoke on pets. And we worked with this property manager as well to kind of co-design the flyer and then drop them off with her in both English and Spanish. And she's planning to put them all around the building and then in people's move-in packets as well. And so we ordered a bunch of little like doggy bags, doggy treat bags, pet supplies, things like that to include as kind of like a goodie bag from the county as like a thank you for not smoking. So that's that's the communication aspect of this. The second approach that we worked with, I have been working really closely with our environmental health team here at the county. And they recently received a grant from Kaiser to provide air filters to the community. I know air filters are not recommended by STEP, but I've been working closely with our indoor air quality specialist, and her idea was to use the intake process for these secondhand smoke complaints to reach out to people to see if an air filter is something that they would want. We have them at the county. They've been secured through this grant, and I couldn't get the name of the grant, but I'm meeting with her this afternoon, so I'll add that in there once I know. But using that as a way to distribute these air filters, and then working with our data team here at the county as well to design a pre and post survey to gauge the impacts of these air filters on secondhand smoke, to see if residents experience any sort of air quality improvement or how they are actually impacting people. And I think one of the things here is that it really is intended to be a community engagement and trust building tool. My experience with handling these complaints is, I'll call someone on the phone and say, hey, here's kind of my realm, here's my jurisdiction, here's what I can do, here's what I can't do. But an air filter and referring them to our environmental health program through this distribution kind of says, hey, we hear you and here's something we can do about it right now. And we can say, STEP doesn't recommend these, they're not evidence-based, but we do have this program if that's something you're interested in. So that's where that came about. And then our last prong here is mediation. So I think it actually just got signed off yesterday, so hot off the press. But I work to develop a subcontract with Find Solution, who's a mediation company based out of Arvada, I think. And they are specifically contracted to help mediate these secondhand smoke complaints. So working with the landlord, working with the complainant, and then working with the smoker to make sure that they are coming to a solution that feels equitable with everybody. They conduct the follow-up, they conduct all of these services. And yeah, and so we've contracted with them for approximately 24 hours of mediation throughout fiscal year 25. So I'm excited to start implementing that now that we have the contract signed. And then lastly, I know I'm almost out of time, but I just wanted to share this kind of development of our process map. We've done a couple of these throughout as we've kind of worked to find a pathway through this. And so I am not a process map person, so please give me a little bit of grace. This is my first try. But basically what we're looking at now is receiving the complaint and then moving to conducting the interview using this intake form that I've linked here. And again, hopefully you all can access once I share these slides. And then asking whether they're interested in an air filter or mediation. If they are, we refer them to environmental health and go through this pathway here. If they're not, offering mediation services and referring them to Find Solutions down here. But no matter whether or not they're interested in air filters or mediation, I want to make sure that we're meeting with the landlord and property manager to provide resources. Again, this is a way to build relationships and engage with community and try to figure out if there's any strategy here that we're missing that we could potentially add in that would address those specific needs of that community or that neighborhood or what have you. And so this process map all kind of lives within this broader communications campaign, which is the ads for the quit line, the ads talking about the impacts of secondhand smoke, as well as the PET flyer. So we expect that to kind of keep developing. I know we're getting a new communications TA provider for STEP soon. I don't remember the exact date, but I know that's coming. So we'll see how that kind of evolves in this fiscal year. But yeah, that's the process. I'll leave my screen up in case anyone has any specific questions. Or Peggy, should I turn over to Nikayta? Oh, I guess I'll hand it back to you.
You're good. I want to just highlight a couple things here that are kind of, we'll call it food for thought. Is this connections, first of all, with like the shelters, right? If you have a local pet shelter, this pet campaign that Adams County has come up with is another opportunity to share secondhand smoke exposure and even cessation opportunities for pet owners who might, discover through them that this is a potential problem for their pets, because I agree, people do care more for their pets than they do community members often. But the combination with the connection with internal teams, this is where we really build those communication paths, and we're doing really good help for our community because we're working as a health department, not siloed projects. And so Casey's letting environmental health know what she's doing, and they're communicating with her, and then they're working together to share these resources of the filters. And then Casey also is able to let environmental health know that the filters is not the end of the road for us. We still would like to have smoke-free policies and support those efforts. But the process map is just really makes it clear of like what steps we take next. And then the fact that they've even gone far enough to really care about housing stability to contract with mediators that are able to have these communicative, agreeable conversations with individuals to have them understand what their expectation is and their rights are. So all these resources and the recordings today will be uploaded to Tobacco Free Colorado by Friday. So you'll be able to access these resources as well as the recorded presentation. Casey, thank you so much for your work and for sharing it with us. Lots of really good stuff in there to motivate others on a direction that they might be able to take. So let's send that now. We'll open up the floor to Nikayta from Pueblo. And Nikayta is going to share her process and her interaction with a community member through a complaint that she worked through And it was time consuming. So I really thought you guys could learn from this. So I will go ahead and turn it over to Nikayta.
Sweet, thank you, Peggy. Can everyone see my screen? Okay, wonderful. So yeah, as Peggy said, my name is Nikayta Neu. I work for the Pueblo Department of Public Health and Environment. Very similar role to what Casey does. I am more of like my role is more of the tobacco retail license and multi-unit housing complaints, or just any kind of like secondhand smoke complaints related to the Clean Indoor Air Act. But this is my presentation on the secondhand smoke response process. So the first step in general in our complaint process is receiving the complaint and how we receive it. And so not every organization will be the same, but at the health department, we receive either a complaint notice from RIA, from environmental health when they receive word of a potential violation, and then or we also receive it via phone through our admin, or through our own website. And so the picture that's shown on this website or on this page is the form that is displayed on our website. And so there's a lot more information when you scroll down. I couldn't fit like the entire form on the PowerPoint slide, but this is essentially everything that we get at when individuals go and submit a complaint. And so then for the overview of the secondhand smoke complaint, the secondhand smoke complaint occurred at a privately owned duplex, and this was discovered by looking up the address on Google, and then Zillow was the first thing that came up. And I only remember that because of the one the one learning community call where Peggy said that anytime any building comes up on Zillow, it's more than likely a privately owned space. And then from the complaint information, it was described how the neighbors are smoking in the house, and the only reason why the complainant knew the neighbors were smoking in the house is because they left their blinds open. And so like anytime they would go in the kitchen, like they could just like, even if they peeked in for like a little bit, they could see that they were smoking in the house, even though they were only told by the landlord originally to keep the smoking in the garage. And so the landlord was notified, but the smoking didn't stop because I did ask if they had notified their landlord at all. And then they also said that the smoking was already causing immediate health consequences for the family. And actually, they weren't super sure if breathing in secondhand smoke could cause things like asthma, or if it can make asthma worse. And so they described symptoms of like their children already finding it hard to breathe and already like coughing a bunch and whatnot. So that was the information we found from the complaint. And then the next step in our process is once we receive the complaint, and then once we figure out, like once we get more information from the complainant, then we see if it actually is in violation of the code. Because sometimes people can submit complaints, but they don't say, like, they're just like, oh, my neighbors are smoking. Okay, well, what does that mean? Like, where are they smoking? How often is it occurring? Is it occurring in like a public space? Things like that, just getting more information. And so after having the potential violation information, we determined that from this, that it wasn't a complaint, or that it wasn't a violation. And I just want to preface this by saying that, like, so the city of Pueblo actually passed a Smoke-Free Air Act before the Colorado Clean Indoor Air Act came into light. And so essentially the Pueblo Smoke-Free Air Act was grandfathered in to the Colorado Clean Indoor Air Act. And so this that you see on the slide here is an example of the city code, not the actual Clean Indoor Air Act itself. So if a violation falls within the city, or if a complaint falls within the city, this is kind of what we have to go off of. And then if it falls within the county, then we go off of the Clean Indoor Air Act. So our processes are definitely split into two different groups, but we also haven't really received a lot of complaints from the county. So in this instance, we followed off of the Pueblo Smoke-Free Air Act, which pretty much says that private residences aren't included in the law. And so essentially that's how we determined that it wasn't a violation. And so for the response process in general, we researched the location. And then I contacted the complainant to get more information to see if the smoking was occurring in shared spaces or if there was a smoke-free policy, because just because they're not in violation of like the actual like law, like local code, whatever it may be, it doesn't mean that they're not in violation of their multi-unit housing facility smoke-free policy. So there's just still more to like uncover with that essentially. And so I provided education to the complainant, letting them know that it wasn't a violation and why it wasn't. Because that's super important, just to like distinguish like, hey, this isn't a violation because X, Y, and Z. And then pretty much I talked through what the next steps would look like for the complainant. And then once I mentioned all the resources to the complainant and then mentioned the why behind it, I sent a follow-up email of everything we talked about and then provided the resources with the links to the complainant. And so the resources included a smoking log. So it was about like the date that the smoking occurred, the time, the frequency, the location, things like that, just to be super in-depth. And then I also provided them with a doctor's note for proof of negative health consequences. If their landlord wasn't being super like cooperative and wasn't like wanting to do anything about the secondhand smoke, things along that line. And so the next step was getting written permission from the complainant to speak with the property owner / manager. And then once the permission was granted, I reached out to the property owner and manager. And it was a little tricky for me at first because this was the first time that I had ever actually like had to reach out to like a property owner whose tenants weren't necessarily like not in violation. So I was like, okay, how do we kind of go about this? And so I just made sure to reach out with emphasis that I wasn't enforcement, that I wasn't like with the police or anything, and that all I wanted to do was be helpful to them and provide them with resources and also educate them on the effects of secondhand smoke. And so once I did reach out to them, just with a lot of emphasis on like, I'm here to help you, I'm a resource for you, like I am not here to get you in trouble, anything along those lines. The housing provider mentioned that they did want to implement a smoke-free policy that included no smoking or other language in the lease. And the housing provider also said that they were in contact with the smokers and asked them not to smoke multiple times. And said that and even asked them to keep it confined to their garage. And so essentially the housing provider also mentioned several times that they didn't really know what else to do, that they were trying to get their tenants to not smoke. But it obviously wasn't working. And so they didn't really know what else to do. And then that's when I said, no, I totally get it. Like that's a common thing. And I said something that you can do is implement this 5-step protocol to get your tenants to either stop smoking or just to get them cessation resources, things along those lines. And then pretty much just said that the smoke-free policies are more equitable and they actually save more money from like smells and whatnot. And so I kept following up with the housing provider, asking for their availability to meet to discuss the 5-step protocol enforcement, just because I didn't think that I could do it justice with emailing it to them. And so I thought that it would be an easier and just more like personable process to meet in person, but they never responded. Shocker. So after 4 or 5 emails, I eventually sent the housing provider the smoke-free multi-unit housing resource packet and told them that I understood that not a lot of people have the capacity to read a 30-page document. So I pretty much pointed out where they could find the 5-step enforcement process. And then I also just told them to email me if they had any questions about it. And then once that email was sent, I sent another follow-up email to the complainant to close the loop. And so in conclusion, once I closed the loop with the complainant and told them the housing provider wanted to implement a smoke-free policy, but I didn't hear anything back. They said the smoking had actually improved, which was nice to hear. I also developed new relationships with the complainant and housing provider. I tried really hard to establish trust and educate both parties, and I felt like it ended up in a really good place. just because both of them had received information and just had been educated on information that they hadn't known before. And so, as for lessons learned, I realized that I had to be resilient and keep reaching out to the housing provider, letting them know that I only wanted to help. And so I tried to think about everything that I could do as the subject matter expert in this situation and thought it was best to end the case on sending the housing provider those resources and educating the complainant. And another lesson learned was that complaint processes can always be amended and fixed to your needs as a public health agency and organization. So, for example, we didn't have it listed on our complaint process how many times we should follow up with the housing provider and what methods of follow-up are recommended first. And so I did work with Peggy a lot on this and basically just said that, like, she was like, send an email first. And so I was like, thank God, because I really didn't want to call them. And it was just super easy and they responded right away. But just keep following up with them, and also just know that, like, you're probably not always going to receive a response back, especially when, like, there is follow-up on your part and push through. But then at the end of the day, the only thing you can really do is just send them those resources and just provide them with, like, why you're giving them that information and hope for the best. Yeah. Thank you.
That's amazing, Nikayta. So much in there that I'm going to follow through on in conversation here in a minute. I want to just allow the group to ask you any questions about your process or anything at all before we move forward with this. Does anyone have any comments or questions for either Casey or Nikayta? Yeah, exactly. Great job. Okay, so since we just finished Nikayta's, let's dig into some detail here. I'm going to unpack this real quick. Not real quick because I have time. They both really went fast, and I was like, okay, take your time and do that. But there was a lot of a lot of really good information there. So Nikayta, I'm going to ask you a question first of all. How long would you say from the time you received the complaint until you close the case? How long would you say that time period was?
Probably between 2 or 3 weeks.
Okay, so it wasn't anything fast. Now, there's a couple things I want to highlight here. First of all, on the initial Google search, we looked it up. There's a lot we're going to talk about settings in our training because settings are very important to be able to kind of help you develop your plan, like plan of attack, right? So when we Googled this property, it was clearly a duplex, right? So what that means, and like Nikayta said, it came up on Zillow and it, had been sold. So we knew there was a private owner. So here's some things you can assume by that, right? The duplex is that probably if they're a renter, they probably have a landlord who rents both sides. That's not always the case, but that could be an initial assumption. So hopefully you would only be dealing with one landlord. Second of all, it is considered private property. So the only way you would actually have any power to engage or to comply any type of regulation on this individual would be through a rental license, right? So if Pueblo had a rental license and this duplex, because the owner doesn't live in it, he rents it out, it's a rental property. Through that rental license, you would be able to engage. Let's say if your rental license required you to have a smoke-free policy, then you could engage on that level, right? But let's go back to it being private. All right. So here's some things Nikayta could have done. She could have sent a letter to the complainant and said, I'm sorry, you live in private property and I have no jurisdiction over that private property. Good luck. And ended it at that, right? But Nikayta had compassion for the individual. Her and her children were being exposed. And she is, a subject matter expert for tobacco and secondhand smoke exposure. So as a public health person, it was her desire to engage and support with resources. So that's where we got into the conversation. Now, when she engaged with the landlord, that again is that's a hard call. I had one with Casey the other day and I was like, oh, I forgot. What are we supposed to ask? So the main thing here was he doesn't have a policy, right? So he owns this, let's say, $800,000 property. And he rents it out to two individuals, which makes him responsible for their health. In other words, he should provide healthy living space for these individuals to make him a reputable landlord. So we can assume that maybe he doesn't know the things that we know. Another legal recourse here, and also the main, I'm going to ask, does anyone want to jump in and say, what is the main thing you would want to message to this owner about his property if he's allowing smokers to smoke in the units? Anyone want to take a stab at it? Okay, I only got my one page up, so go ahead. Who'd jump in?
I was going to just suggest that the economic benefits to the landlord regarding cost savings on a number of fronts.
Absolutely. Donna hit the nail on the head. Now, here's another thing that you can say to them. There is now a Colorado law that says if smoking has occurred in the building that you're selling, this is a real estate law, that has to be disclosed. So if this gentleman, we can assume that if he has rental property, he's doing it for an investment, right? Like he's doing it for business to make money. When you can tell someone something that's going to hurt your profits, that's a strong message. So you can share with them, not even that he said smoking in the garage, right? That's still, you can talk about how smoke travels and it, sometimes you have to go down to studs, but you can also say, real estate law now requires owners of property to disclose when their property's been smoked in. That's because of third-hand smoke damage and the dangers that third-hand smoke show to other people, even years later, not just while it's happening, but years later. So that is a law. So that's a messaging. You want to make sure when you're talking to these property owners that the health consequences of their residents aren't always going to be the selling point for them. It should be, for us it is, but for them it really could just come down to money. So by telling the gentleman, first of all, about the real estate disclosure law, and you want to help him improve the value of his property. Chelsea, you want to pop off and ask the question if you don't mind?
Sure. I just wasn't sure whether or not there could be any kind of like civil liability to a landlord or a property owner if a tenant develops asthma or cancer or another health effect as a result of secondhand smoke exposure. Yeah, not being a legal expert, I would say, of course, we wouldn't want to recommend any legal advice to individuals, but most certainly if they're being damaged by the condition of the property, and that would, assumingly, that would also be a course. There's no real legal precedent on that. So there's nothing to say like, oh yeah, this is done and you could be liable, but you could definitely mention you could be liable to the health of your resident should they decide to, we say that to landlords of multi-unit housing all the time, is like, and HOAs, like if they ask you to protect their health and you say no, then that would put you in a position of not protecting their health. Again, I'm not a lawyer, but I would say, Chelsea, my thought on that would be yes, getting that to go through the courts and find an attorney to support it, and it would be difficult. So let's say the landlord had told Nikayta, no, I don't care. Here's what we learned is that the individual that lived in the other unit had lived there for a long time. And, this other person had just moved in.
And it could be that this landlord keeps losing a tenant because he's allowing this person to smoke. So someone moves in and they get exposed and they only stay a year because they're like, I'm out of here. So you can always bring that up. It's like, well, this tenant's lived here for a long time and I've told her to smoke in the garage. And you could ask the question, well, do you find that you lose tenants often in the other unit because of secondhand smoke exposure? So had he not said yes immediately, there would be other areas that you could kind of explore with him to point back again to like, hey, you want a long-term tenant, you want them to be safe in their housing. A couple of things that I urge Nikayta to talk to the individual. First of all, I just really want to highlight that she got permission from that individual to talk to the housing provider. You never want to proceed to talk to any landlord or housing provider without the permission of that individual, because you could put their housing at risk. So what I usually do is, even in email, do I have permission to contact your housing provider on your behalf? And who have you been talking to? And could you give me their contact information? That individual may not be the correct person that they've been talking to. So that may not be the person, but it is the starting point for you. But please don't reach out to landlords or housing providers on these complaints without consulting with the constituent first. That person that gave that complaint doesn't know that you're going to follow through. They should expect it, I guess. I've heard many grantees say, well, they're complaining, they should expect that. But again, not necessarily. I think it's always good to get an email with the approval. And if they say, well, I'm really scared because we just had this happen in Otero County, I'm really scared of the retribution, you can share that they're protected through the warranty of habitability, Lord of mercy, that they're protected against retaliation from a individual complaining about a housing condition. But again, that's a legal action. They're going to have to get an attorney. And so you don't want to tell them, you can't assure them, yeah, 100% you're safe, it doesn't matter, because that's not true. It shouldn't matter, but it often does, especially if they're in housing where they can't find alternate housing and then they end up getting evicted or retaliated against. So the first step in this process is always talk to the constituent, get the approval to talk to the housing provider, and then talk to the housing provider. But talk to the housing provider like you're trying to sell a product, right? You want to sell them the product that they're going to find usable, right? You're not going to tell someone who doesn't have a driver's license the great benefits of this car, because they don't understand it, right? So speak in their language when you do this. But the main thing is, what I really want to commend Nikayta on in this was her just persistence in trying to find support for this individual when she really didn't have to, because it's private property. So she, really gave the person resources. And then I also said to her, listen, I've looked at the property line, look at it on Google Maps, and it could be, if it's only two, right? You've got one, you and another owner, very intimate settings. They literally share the same front porch. So there are times where if the smoker finds out you've complained, they can become a terror. They can start smoking outside your bedroom window in the backyard. They can smoke right there on the front porch. They can make it worse. So we really want to proceed in these areas, not to cause harm to the individual, but to find solutions. So I think that Nikayta she really she followed everything that I would have recommended, and everything perfect. So the two resources that she shared was the smoke exposure log and the doctor's note. Doctor's note is Donna's resource. We thank you, Donna, for that. And I'm going to share that on Tobacco Free Colorado's resource. And then the smoke exposure log. The smoke exposure log is something that really every individual that you need to support needs to start with this, because it documents when, how often, and where, and the effect. So because when someone being exposed says, oh, it happens all the time, you know what, that doesn't have much weight, right? All the time. We're like, okay, whatever. But if you can sit down, especially if this goes to mediation, and we're going to get into that right now. If it goes to mediation, then they can bring that document with them to mediation and say, this is what's happening. And it doesn't look like just a haphazard occurrence. It looks like something that is real and that needs to be addressed. So, does anyone have any questions about any of that? We covered filters, we covered smoke log, doctor's note. I do have language on the filters too that I'll attach to Tobacco Free Colorado as well. We covered the benefit of rental license. And really, this all points to the need of a larger ordinance, right? Like if housing were included in the Clean and Door Act, or even our local ordinances, if housing were protected, any shared housing, then that would be perfect for us. So this is where we're moving to, because we don't always get landlords that care. But anyway, I will also put that law, the code law in Tobacco Free Colorado as well, so you know what to refer to, and you can read up on that real estate law as well. So that being said, we do find that some of our complaints get to a point where we really want to go to mediation instead of, like Casey said, instead of evicting individuals, instead of individual losing their housing because of smoking violation, or just to help the person who's being exposed to understand that the housing provider's really done all they can do or are willing to do. There are several different reasons for mediation. We have been able to start a pilot program this year for folks who do not have mediators or access to mediation. So this year we're doing this process. Steve, if you want to pop your camera on so I can see you. Are you here? You're on my second page, probably.
I'm here and my camera's on.
Oh, perfect. I see you. You're on page 2. Perfect. There you are now. So today I'm want to introduce to you Steve Charbonneau, who he used to be the CEO of Find Solutions, and now Allie is. Steve is still organized with that, and we're contracted with them to offer mediation for you because you may not have access to that. We want to try to see if mediation is a supportive resource for these complaints, as we do mention in step 4 of our enforcement process, perhaps mediation. But I'm going to let Steve talk a little bit more about the project, kind of like what to look for from mediation, what to expect, and kind of what they might need before we go to mediation. So that being said, Steve, I'm going to give you the floor, and I'm glad we have the time to cover this today.
Good. Well, I just want to say hi to everybody, and I'm happy to talk about mediation. I've been doing it for about 28 years. So been doing it for a little while. A lot of that is done with community mediation. So we're pretty familiar with sitting down between folks that live next door to each other, or one lives above the other in an apartment complex, or that kind of a situation. We don't do, the big corporate mediations like that. We do neighbor to neighbor. We do community mediation. We do that for a number of different municipalities, largely up and down the Front Range, but occasionally outside of that area. We're also able to do it in person, but have found that for a lot of people, being able to do mediation virtually has worked out really well for them. It's a lot more convenient, easier to schedule, easier to work with. So I'd like to talk about mediation in this context because I think it's just another tool in your toolkit. You guys are faced with these kind of challenges and you're thinking to yourself, okay, what's going to work best here? How do I reach into that toolkit, and how do I grab the right resource for this situation? So there's a couple of things that I think are helpful to think about. Mediation is really a non-threatening opportunity to sit down with a professional mediator or someone, the professional mediator, who can help you talk about what you need to talk about. It's pretty tough, really, when you think about it, to go over to your neighbor and say, hey, I want to talk about this because it really is bothering me. It's a whole lot easier when you've got somebody there that kind of pulls you together, that kind of creates a a context and creates a format or a process for talking through whatever the issues or concerns are. Our mediators are good at that. And I understand that some of you have access to mediators, and that's all great, well and good. But I also know that some of you don't. And that's the resource we want to be for you. We'll either help you find a mediator, or we have about a dozen mediators who work out of our organization. I think there's a number of benefits to mediation. It's not going to cost the complainant or the person who's accused of smoking. It's not going to cost them money. It's a pretty timely way of resolving a conflict. Most of our mediations take about an hour to an hour and a half. Also in that process, we put together a written agreement of expectations or a summary. And it's not that the mediator comes in and says, hey, this is what you're supposed to do. It's that the mediator helps the parties talk about what options they think might work. Mediator may on occasion say, you know, I've seen people try this before in other situations. Don't know if that'll work for you guys or not. So it's not like the mediator just sits there and is totally reliant upon them coming up with any kind of ideas or solutions. But it's not the mediator's job to come in and say, here's the 3 things you need to do. We will help them talk about the impact to each other. We'll help them talk about the challenges, and we'll help them identify options in moving this forward. The other thing we do is we will continue to work with them if they run into problems somewhere along the road. Say maybe a week to 10 days, they go, hey, this isn't working. I thought I could do this, but this part isn't working. Can we talk some more? We'll be a resource for that. We will, if we don't hear from them, we will definitely follow up within 30 days. And we'll say, how's this working? It's my experience, our experience, that it doesn't do a whole lot of good to get people to come up with ideas that might work and then just walk away and say, good luck. And so it's helpful to give them a chance to sort of put those training wheels on and try it for a couple of weeks, 30 days, and see if it works for sure. Peggy, that's kind of a quick overview. I'm happy to take questions. I'm happy to talk about any of that. But I'm also happy to move to a little bit about kind of what we're thinking process-wise, and I can share my screen if we want. I'm not sure what would be most helpful moving forward.
You can go ahead and share the process. I do want to kind of circle back at the end and answer, talk about 2 things. Maybe we'll just do that now and then do that. I just
Okay.
want to make sure we can do both. First of all, the question may come up. There are certain demographics of folks that are required by law to receive mediation prior to being evicted. Those are folks on Social Security. There's 3 different protected classes. These folks have to get mediation prior to being evicted or having their lease non-renewed. This mediation process does fulfill that expectation of the housing provider. So that's a good way to have the housing provider kind of agree to mediation, is saying this does fulfill your legal requirement to mediate with those protected classes. I'll spell that out a little bit more also in my notes, in my follow-up. But just, do you think that question that Chelsea had about, let's say if this had gone sideways with Nikayta's complaint and the person said, no, I'm not quitting, and the landlord said, I'm not helping you, and she would say, like, perhaps in mediation, this might be where that individual would bring up, my health is being impacted, and I'm going to seek, I'm going to seek a lawyer, or I'm going to look into, some legal matters to protect my health. That would be something that maybe the individual might bring up in mediation to the housing provider at this point in mediation?
Is that a question to me?
Yeah, like, is that a question or a statement? Yeah, I'm just kind of saying that might be an opportunity, right? When the individual would bring up in mediation, like, if this isn't solved today, I'm going to have to take this further. It is just that opportunity for them to say, like, I'm serious about this. But
The
just
value,
when,
Yeah. The value of one of the things I didn't mention about mediation is that there's a state statute which protects the confidentiality of mediation. And so it enables people to talk about whether that's a property manager to an owner, whether that's property manager to a tenant. It enables folks to be honest and not worry about where that's going to go because it is protected by a confidentiality statute. We actually have them also sign a confidentiality agreement when we get started when it comes to the mediation. There was a question in the chat about the cost of this to a county. I know, Peggy, we're kind of working through some of those particulars as we go through that. But I would say, just it's less than $500. I know when it comes to that, the whole process from start to finish. I think we're looking at finding some ways to keep that even less than that, more minimal than that.
Mm-hmm.
I don't know that we have
And-
all of that ironed out yet.
And Kathy, for you, if you find this process supportive and you have funding that you would like to support this, certainly I would reach out to Casey. They just finalized a contract with Steve's organization, and I know we have one at our city with them as well. They handle all community complaints. So Steve and his group would be able to talk to you about what a contract like that might look like. Like Adams County has a contract with them to provide 25 mediations. Denver County has a contract with them. I think it's unlimited. I'm not sure, but we do it for barking dogs, trash in the wrong place, all kinds of things that come in through 311. So that is definitely a very good question. But for this process, in this grant cycle, the TA grant is covering that mediation cost. And great. And mainly we're doing that just to be able to show you how productive mediation, hopefully how productive mediation can be, and to give you an opportunity to secure this neutral mediator. And it doesn't have to be Steve's group. It could be anybody, but they can certainly talk to you about what a contract might look like. And yes, shoot me an email. Thanks.
And I think during this next year, as we're trying to get this all sorted out and implemented, I don't want money to get in the way. So we've operated as a nonprofit for, like I said, 28 years. I don't want money to prevent us from getting something like this solved. I mean, we've got to pay our mediators just as everybody gets paid, but at the same time, we'll work with you to get something worked out. Like I said, don't want money to get in the way. Let me see if there's other questions just before I pop up the screen. Have any of you, I have a question. Have any of you tried mediation? Has it worked for you? If it has, did it work well? If it didn't, what went sideways or what went wrong? You're a quiet bunch. Let me go to the share screen then. Feel free to jump in if you change your mind and want to say something.
I did have a quick clarifying question, if I can ask. What are the typical parties involved in the mediation? I guess I'm wondering, is it typically the property management and the tenant that is smoking, or is it the property management and like the tenant that is complaining, or does it just depend on the situation? I'm curious as to what that can look like or has looked like.
That's a good question. That's an important question. We are, in some ways, we're sort of feeling our way through that also. But I would say, as a general rule, overdoing hundreds of neighbor-to-neighbor complaints, the closer you can get to the two individuals that are actually having the conflict, the more successful you're going to be. So our preference would be to work with the complainant and work with the smoker. They're the ones who live in proximity. They're the ones who are impacting each other. They're the ones at the end of the day who are going to actually have to do whatever it is to make it work. I realize that we're not always going to be able to work with the complainant and the smoker. So we'll work with whomever we can. There are times, and we're working on a couple of smoking cases right now, and there are times when, we have a difficult time, or you will have a difficult time getting all of the contact information for all of the parties. And so sometimes you end up going through a property manager, and sometimes the property manager says, well, let me sit down and be a part of that mediation and let me see what I can do. Other times the property manager is more than willing to say, hey, if you guys can solve this, fine. Here's a phone number. Call them and see what you can do. Our intake process will work at figuring that out. The other thing, and you'll see this on the sheet that I flip up in a moment. The other thing, you can call Sarah, who is our intake coordinator, and you can say, I got an idea. What do you think? You can call Peggy and say, I got an idea. What do you think? From our perspective, that's not going to cost you money. We're not going to charge you to pick the phone up and call Sarah, or Peggy's not going to charge you money to pick the phone up and call her and go, hey, here's where I'm at. What do you think? So the short answer is we're going to try to get the parties that are directly involved. The long answer is we'll get whoever we need to get this thing resolved.
Thank you, Steve. So we've got 3 more minutes. I want you to share the process. We are going to be sharing this, and we're
real
firming
quick.
this up.
I'll be real quick. Sorry about that.
No. It's fine. We're going to dig more in this. This is just a simply introduction, and we're going to dig more into this. I just wanted to make sure you met with Steve and we introduced it. Sure. And so anytime you need to jump off.
What we've done is we've said, here's the complaint. Here's kind of how that's going to look. We've outlined the pre-mediation steps, which I talked a little bit about here. Peggy and a grantee begin to collect this information. Do we have the information? Has there been that face-to-face meeting? Have you worked through steps, 1 and 2 and 3, or where's the appropriate place to give us a call? Here's where you can brainstorm with Sarah at Find Solutions. Here's her number. Here's her email. Here's some possible ways to consider. Has the housing provider or the property manager been unresponsive? Does the secondhand smoke exposure continue to smite the housing provider's involvement? Is the resident facing eviction? There's all of these questions that kind of lead us to say, yes, mediation is probably a next good step. We've talked here how to refer to mediation and how to send that over to mediation. And then we've talked, I don't see the little box that says to mediation, but it talks about it down here. You'll email the referral information to Sarah. Sarah will keep you and Peggy in the loop as to what's happening. We'll provide you after the mediation with a follow-up, copy of the MOU and the summary. And we'll also follow up in 30 days and give you an update on what we find there. That's a very quick overview, but I only had 2 minutes to do it. So we're gonna continue to refine this. Peggy will get this email out to all of you, and we'll work with it from there. That was quick, Peggy, but
that was good, Steve. That was really good. So yeah, this is just now being kind of finalized. I'm going to do a workflow and send those documents out to you guys. And then you'll understand better. Our next learning community call is November. We're going to talk about KPIs, which are key performance indicators. Like, what are we trying to do with this work, and what should we be tracking? How should we be tracking it? And what are some performance goals we might want to set for ourselves if we want to evaluate or try to examine our process? So we'll do more of that in November. We certainly will be refining this and sending this out to you. We are at time. That was a very full call. I only get these once a quarter, and an hour is awful fast, but I did want you to know what's going on in some counties, and you can reach out to Nikayta. You can reach out to Casey with any questions that you have. I'll send out the meeting updates and the next meeting invite by Friday of this week. This call was recorded. I will post that recording and share that with you. So if anyone on your team or you want to refer back to the recording, you'll have access to that. Lots of words. Okay, guys, have a good week and enjoy your Labor Day weekend. Appreciate you attending today.
Thank you, Peggy.
Hey, Donna, you're on mute.
Probably a good idea. I missed the very beginning of the session, and I saw somebody saying something that made me worried about your job.
Oh, the county cuts, the city cuts happened on
Yes.
Monday, and
Yeah,
171 people were let
I
go.
did.
And I survived. We lost two
Yay.
team members. Yeah, no,
Oh, you
we
lost
did
two.
lose two team members. And it was
In
a
the
hard
tobacco
time.
program? In the
Yeah,
tobacco-
yes, our executive assistant and one of our investigators.
Gotcha.
So
Okay.
yeah, so
All
it was
right.
a hard time, but we survived it, and
Mhm.
and I'm happy for that. I hope you
That's
don't
good.
mind that I'm sharing your doctor's note resource with the grantees. I didn't think you did.
Anything you want to share
Mhm.
is great.
Yeah.
Anyway,
Yeah.
I have a call, so I better hop off and get
Yeah.
on that. But I thought, oh my gosh, I saw somebody with tears, an emoji with tears, and I went, oh no. So,
No, I
all
was
right.
afraid I wouldn't be able to host because I'm like, well, if I lose my job on Monday, someone will have to take the learning community call on
Yeah.
Wednesday. So all is good for this year, but who knows what'll happen in the future? You know how that goes.
I know. Whee. All
All right.
right.
Well, enjoy yourself. Talk to you
All
later.
right. Thank you.
Bye-bye.
Bye bye.